Our second segment of the program this morning features a retired physician who is also founder of a national organization called Health Watch USA, Dr. Kevin Kavanagh. Good morning, sir.
Good morning, Jack.
How are you today?
Doing very well, very well. A little cold, but next week hopefully will be warmer.
I had to take some suit over to a lady who has done alterations for me for years, and you would have been so proud of her yesterday. She was wearing an N95 and a visor, absolutely insisted that anybody who comes in her place is wearing a mask, only allows one person in her place at a time. She works on a schedule. She is doing everything that she can possibly do to stay safe. And she told me that she has had both of the vaccine shots and a booster shot. And I said, well, it looks like to me you're pretty well protected. And she said, I hope so. I want to see my grandchildren grow up. Now, that one would admit, and it's absolutely her business, and I'm not knocking her in any way, but one might consider that pretty extreme. I don't think you would.
Well, no, and I'll be honest with you, if you were in mainland China, that would be considered very relaxed and mild. No, if everybody did that, believe me, we'd save a lot of lives in Kentucky.
But everybody's not going to do that, and we're getting into this let's not wear masks anymore mentality.
Well, yes, and that's very, very distressing. We're not out of this yet. The Stealth Omicron, which is the BA.2 variant, is out there lurking. This has been defined as a variant of concern by the WHO, and it's concerning. This variant can evade immunity. It's more infectious than Omicron and appears to cause disease as severe as Delta. So it's something that needs to be watched, but it certainly means we shouldn't be lowering our guard.
Vaccination is of significant benefit after a COVID infection, according to a couple of studies. Can you tell us about that?
Well, yes, 2 studies were published this week in the New England Journal of Medicine, which really does drive home the point that if you've had a previous infection, you need to be vaccinated. Now, remember, some of these previous infections occurred 2 years ago. And one study, this was out of Israel, this found that you were much less likely to get a Delta variant reinfection than if you were not boosted. That is, those people who had an infection, they would more likely to get a reinfection if they were not boosted with a vaccine. In other words, they would get a vaccine. And the difference was 4-fold. It was a big difference. Interestingly, that study showed that 1 dose of the vaccine may be as good as 2 doses if you've had a previous infection. Another study, which was published in the New England Journal of Medicine, really compared natural versus vaccine-induced immunity with the Delta variant. And as we've stated before, pre-Delta variant vaccines appear to do better. Delta variant and beyond, natural immunity appears to do better. Well, in this study, at 201 days out, those that just had a vaccine had an efficacy in preventing infections of 51%, which is a pretty low efficacy rate. And if you can remember back in August, we were saying if you've had a 2-dose vaccine, you need to get boosted. And that was the reason the vaccines were waning. Of course, you can't do that with an infection, go out and get another infection, but you can go out and get boosted with the vaccine. Now, if you had a primary infection at a year's time, efficacy was down to 69% at preventing infections. And of course, as I said before, we're now 2 years out with this pandemic. But if you had a primary infection and then had a vaccine, your protection at 1 year was 90%, and they didn't see any signs of waning after 1 year, and they didn't see any signs of waning after 6 months of you getting that vaccine. So there is a huge benefit with the Delta variant of getting a vaccination after you've had an infection. Of course, now we have Omicron. I would suspect the same principles apply, although I would also suspect that immunity from either vaccination or infections are not going to be as great. So it is even more imperative you go out and get a vaccination and you follow public health advice.
This information still out there?
Well, it is, and some of it is confusing. And I think, you can look at this on both sides of the political aisle. Unfortunately, it's been politicized. One side will say, well, if you're vaccinated, everything is fine. That I think we can definitely say, no, vaccines help, but they're just a layer of protection. Another side will say, well, vaccines don't work, don't get them, et cetera, and that's not true either. And one of the facts which is going around is that in one article, it was just one, found that after 90 days from vaccination, you were more likely to get an infection. And people would say, well, why is that? Are vaccines causing the infection? And the answer is no. Probably what's happening is you get a vaccine that maybe protects you 50% from getting an infection, but you think you're fully protected. You go out and engage in risky, unprotected behavior, and you have then a fourfold chance of getting infected, and you combine the two, you're negative in your protection, and you start developing infections. And so that's really kind of distressing, so that you have to remember that just because you implement a public health strategy or you implement the vaccine, it doesn't mean you can go out and act crazy, because none of these things protect 100%. And kind of as an aside, I was kind of thinking, Jack, that 4 years ago we would talk about engaging in unprotected, risky behavior, and everybody would think you were talking about sexual encounters. But nowadays it's just being within 6 feet of someone. So things have really changed with this pandemic. We really need to up our game on public health and on safety.
Dr. Kevin Kavanagh and Laura is on hold. Laura, good morning.
Good morning, Jack. Good morning, Doctor. Listen, I'd like to tie two recent news articles together real quick. The Canadian truck drivers and your question on your website about who should decide what the kids do in school about masks. Canada, that truck drivers strike makes no sense. 90% of their truck drivers are fully vaccinated, and Canada has 1/3 the deaths we have. Okay? What they do is work together sensibly, and they have national health care and all that. Okay? But it's not... They handle it differently than we do, okay? It's not do as you please. Let's all work together, and it's working up there. Now, the thing with the masks in the schools, I have cast apparently the only vote for government being in charge of deciding masks on schools, and I was thinking the health department ought to be deciding, our scientists and medical people, and what really makes sense in protecting the children. Am I absolutely nuts, or am I dumb as a post, or what's going on here?
All right,
I'm not even making sense to me anymore.
I'm going to let you listen to the answer off the air. You make sense to me, Laura. Go ahead there, Doc.
Well, yes, I agree. I think that health departments need to have a major input into whether or not schools have masks during high periods of viral spread. I think they need to be mandated along with other interventions to keep children safe. Many times they'll have caregivers which are very high risk for disease and for COVID-19. And children, although they're not nearly as high as risk as adults for severe disease, they still can readily spread it to their caregivers. And we've observed that in a number of our own family units. And so I agree with you. And I think that the current House Bill 51, that absolutely prohibits mask mandates, is very ill-advised. In fact, this bill is prohibiting mask mandates for any bacteria or virus, including COVID-19 or any of its variants. And that, to me, is just throwing public health to the wind and saying we're going to put our children in risk and danger of any pathogen today or in the future. And so I don't know what went into the writing of that bill, but certainly I think we shouldn't be passing that one in the Kentucky legislature.
Kentucky's Governor Beshear has also sort of lightened up his approach. How do you feel about that?
Well, at this point, I think we need to be careful. People need to have a reprieve, but a reprieve means we may have to go back and start to put on masks and have social distancing. Now, right now, with a positivity rate of 15%, I wouldn't lighten up yet. But if it falls, as I've said before, below 5%, then I think you can really consider lightening up on some measures. One of the things that disturbs me, as we've talked about before, is that there's other variants lurking out there, the most concerning of which is the Stealth Omicron, which I think is going to be getting its own Greek letter pretty soon. And that may cause even more havoc than our current Omicron variant. And it also effectively evades immunity. And that is something that indicates we shouldn't be letting down our guard.
And even if it's not this one, there's going to be probably another variant, or could possibly be another variant, whether it's the stealth one or the next one. And until it's gone for a while, I'm with you. I think we still need to be very cautious.
And I think schools need to up their game. They need to start fixing ventilation, having testing programs, surveillance programs, case tracking, masking, social distancing. All of these interventions need to be done, because if we don't have another wave this year, we'll probably have another one next year or the year after. Remember, this virus is endemic. It's in white-tailed deer. And believe me, as I said before, the deer are spreading it outdoors. They didn't get it in an indoor retail establishment. So even if you're outdoors, if you're within 6 feet of someone, you can still get droplet spread. And those people that are running and huffing and puffing down the sidewalk and running past people, that to me is something that is very ill-advised. The person they're running by could well be immunocompromised, and they could be the cause of a serious illness. So we really do need to respect and look out for others.
We talked about House Bill 51. Let's talk about the fact that people in the U.S. want to continue to work remotely, and it's not just because of COVID, right?
Well, yes, and we talked about this before, I think early on in 2020, that this, big push of bringing everybody remote back to work and how it was causing such a disruption in the workplace, that actually this was a way that a lot of the workforce is going to be transformed. People are going to work from home. It's more convenient for them. Some of the companies have noticed increase in production. It's much less expensive for the company. And so that this is going to be permanent. And 76% of people who are currently working from home want to continue to work from home after the pandemic ends. So I think that's one of the ways we're going to see the pandemic transform our society. Also, I think that curbside pickup, ordering your goods online and having them delivered, all of that's going to play a much more important role in our lives.
Have a good weekend, Doctor. Thank you. We'll talk to you Monday.
All right. Thank you, sir.